Not that long ago, I had a patient who survived, a very young patient, survive a truly catastrophic injury that if you looked it up in all the books, that person should not have survived. And when that patient woke up and went back to her life, she came back to me about 6 months later and said, "Why was I the one that survived?" I want to be able to answer that question, because whatever that magic was that we created for her, we want to be able to do that for every patient. In healthcare today, we probably use less than 5% of the information that's gathered on patients to make our decisions when we're in these time-pressured, time-sensitive environments. We generate more and more medical-related data, and up until recent times, we have not had the computational expertise, the tools, and the equipment to be able to take that information and translate it into something meaningful. The emerging field of using advanced analytics with large data sources is going to revolutionize the way that we provide healthcare. The goal of the trauma bay of the future is patient-centered care, where all of these digital inputs and the data we gather from the care we provide leads us to new opportunities to mitigate risk and complication for patients. Nurses maybe aren't using the computer to document anymore. They're back at the bedside of the patient like they used to be. And a computer is automatically documenting all the important things, and the humans are just augmenting what the automated information is that's flowing into the system. As the clinician at the bedside, I'll be able to be ultrasounding, and the ultrasound will tell me when I've gotten enough images to arrive at an interpretation. So it will be able to say, here in this particular location, it appears that there is blood. I'll be able to then more quickly tell the people around me to hang blood products to help resuscitate that patient. At the same time, the monitors that the patients are hooked up to are smarter monitors. They're gathering more meaningful information on the patient that tells me at what point in the physiologic space is the patient. So right now, you're in extremis, you're doing really, really poorly. And if I do these particular inputs, we expect that you'll be in this next space in the next 5 minutes. And if you're not there in that space that we predict based on the decisions we make, the monitoring technology will help to tell us, you're not there, and here's where we need to change our pathway to get you there. The advances in computers and computer technology has really allowed us to be able to do what we theoretically have believed was possible for a long time. And now we're changing theory into actual practical application. We are not off in a lab growing cells and testing things, which is all important research, but this actual research is done side by side with the patient. I think the exciting part about the work that we do is that our solutions are not 10 or 15 or 20 years in the future. Our solutions are now. When I go to the operating room and I have to operate in someone's chest and I'm the one that's touching their heart, that's an amazing experience. And the ability to bring tools to the table that help me do that job even better, I know that it will mean that I can save more lives.